It turns out cats can catch the virus, and I'm titling this one Idiocracy because, oh my gosh, we might figure out how to get past this virus, but the economic missteps by the managers are going to be really hard to get past at this point in time. Hello, everyone. This is Chris Martenson, Dr. Chris Martenson, I should say, here with your daily SARS-CoV-2 update, a.k.a. the honey badger virus. Why? Because, God, it's terrible when it gets into your body, does a lot of damage, and can escape if you let your guard up just for a second. Today is day 75 of our reporting, and this one is titled Idiocracy. Again, for those of you who don't know me, my name is Dr. Chris Martenson. I have a PhD in pathology from Duke University. Got a number of papers. There's a couple. All right, enough of that. Let's move on to the numbers. These are yesterday's numbers. Today's April 7th. These are April 6th numbers again, so I can show complete day numbers. If I put up today's numbers at this time of day, there'd be a bunch of holes in here, and it would be very hard to interpret. So we're a day behind on these numbers. Now with, as of yesterday, over 1.3 million cases worldwide. United States pours on 30,000 new cases, and deaths are well over the 1,000 mark on a daily basis. I believe today, though, for April 7th, when I looked at this jumped by another 2,000, went to 12,000. So tomorrow's numbers are going to be a little shocking when we get there. As well, there's a lot of serious cases, many thousands here, and Spain, Italy, Germany, all really, tons of cases, many coming on. Everybody here over the 100,000 mark. France will be over the 100,000 mark soon. China, with its usual 39. It's either 39 or 33 or 38. I think they're just playing numbers games here at this point in time. Very unbelievable what's going on there. So I don't put a lot of stock in China's numbers at this point in time. The UK coming on very strong here, as well as Turkey, piling on a lot of cases here as well. And this is something that's very much not yet contained. In the UK, their prime minister got moved into ICU, has been there, spent a second day there. Rumors that he's going to have to be intubated. Obviously not a good sign for Boris Johnson there. And I think that this should help just make it a little bit more serious for world leaders that it can strike anybody, including the Prime Minister of the UK. So let's look at this data now real quick. A tiger? Yep. First off, it's amazing to me that a tiger can get a test, and a lot of humans I know couldn't get a test. But at any rate, leaving that aside, it turned out that a tiger at the Bronx Zoo has been infected with the coronavirus. Now, we know that there are feline coronaviruses. What's really fascinating to me about this is that, first, it was a human-to-cat transmission. But second of all, it was that the several lions and tigers at the zoo showed symptoms of respiratory illness. So it's having a similar effect, not thought to be quite as bad. All the other tigers are expected to be okay at this point, the way it looks. But the idea that they would have a similar symptomology to humans is really bizarre. And so reading further down into that article, this is from the same article, a pet cat in Belgium recently tested positive for the coronavirus, but the American Veterinary Medical Association said that not enough was known to change the current view that neither cats nor dogs appear able to pass the virus to people. So we're pretty sure humans can pass it to the cats. No data to say they can go in the other direction. However, a scientific study in China, not yet been peer-reviewed, found that the virus reproduces efficiently in cats and can be transmitted by respiratory droplets. But this was in laboratory conditions. The report did not say what kind of symptoms the cats experienced, if any. All right. Excuse me. If the cats have respiratory droplets and it's got these viruses efficiently reproduced, then you can make the conclusion. You can just conclude for yourself that cats can pass it to humans. That would be the precautionary principle would say, as soon as I see that cats are producing respiratory droplets with virus in them, I'm going to tell you that precautionary principle says you have to assume the cats can pass it to humans. All right. Another report, which has not yet been peer-reviewed, concluded on the basis of blood tests that cats had been infected in Wuhan. The World Organization for Animal Health says there is no evidence that cats or dogs spread the disease to humans, but that anyone who is sick should take precautions in contact with their animals as they would with people. So nice for the World Organization for Animal Health to say you should worry about passing it to your animals. I get that. I've seen no data for dogs, none, zero. But for cats now, I think it's safe to say, yes, cats can catch COVID, and a precautionary principle would say, and maybe they can pass it back to humans. All right, Italy is prologue. Remember, Italy went before the United States and the UK and other countries with their illness progression, and so they were prologue in that sense. But now Italy sending another warning here. This is a New York Times opinion piece. And so now we're going to talk about economically what's happening. A month into the lockdown, people are desperate, they're hungry, they're scared. This is from today. And so let's look into this. The desperation is taking its toll. And that's what Armando Gallinari, a father of 5 who runs a small flower shop in the north of Naples, told us. His shop has been closed for nearly a month. Since then, I've had nothing coming in at all. As of yet, I haven't received any government assistance. We have nowhere to turn. Everyone knows Italy's story by now. The first European nation to be hit hard by the coronavirus, it has become a harbinger for the rest of Europe and America. First, there was the lockdown. Ding! We have those in many other countries now. Then the sight of a healthcare system stretched to the point of collapse and the terror of a rising death count. Ding, ding! We got those in other countries. But now, nearly a month after the country went into lockdown, nearly a month, Italy is sending another warning. The economy is in trouble, bound for a major contraction, that's an of course, and the precariously situated workers, self-employed, seasonal, informal, are suffering the most. It's not clear how much longer they can survive. So the problem here is that you have all these people, particularly those you might call them marginal workers, but they either have seasonal, temporary, but there are a lot of very important jobs that happen, but these are not people who have what you would call a full-time job. And the self-employed. Many of these people they don't show up on the official rolls. And this happened in the United States. There's all this help coming, but it's really for employees. What do you do if you're self-employed? A little less clear how that all gets taken out and taken care of. All right. Continuing on with this particular story here, this gives it the detail I think we need. Even workers who are in the system can fall through the cracks. Lucia Vitali works at the Naples airport for about half the year, catering to the hundreds of thousands of tourists who arrive from March onward. For the other half of the year, she and seasonal workers like her can claim unemployment benefits, but those benefits have now run out. And they can't get help from the government because, Ms. Vitali says, we don't fit into the right categories. The government has granted a one-time payment of 600 euros, around $650, to the self-employed and to seasonal workers in the tourist sector. But Ms. Vitali technically works in the transport sector, so she can't apply for the support. For now, she too is getting by with handouts from volunteer organizations. So a technicality, she's in the transport sector. She's not a seasonal worker, even though she works seasonally at an airport. So that's how that's happening there. And so in the United States, we're seeing a similar thing, which follows this pattern, which is there's complexity. You can't just give people money, and they've got all these rules and these sectors and not those. And that stuff takes time, and it's slow. And this honey badger virus moves at exponential speed. So the pace of the managers and the bureaucrats they can't quite get out of their own way. They can't think of ways to get things to people more quickly. The humane thing would be to just say 600 euros to everybody. Boom, done. And it happens instantly, right? So as I like to say in the stimulus distress story here in the United States, when days count, the checks are only months away. So let's switch over here now. I'm going to show you this one thing right here. Let me see if I can center that up for you a bit. This is in Kiplinger here, and saving money section. Your 2020 stimulus check, how much, when, and other questions answered. So I'm not going to read through this whole thing, but I do want to go through some stuff. Look at this. First, you need a stimulus check calculator that tells you how much money you can expect. Because it's kind of complicated and it phases out, and some people apply and it doesn't. How many stimulus checks will I get? Well, you get just one. How much money will I get? Well, it's $1,200, but it's not that simple. It could be higher. It could be lower. To calculate the amount of your check, you start off with this, and then are you married? Do you file a joint tax return? Then you get this, but if you're in this circumstance, it might be that. So, and if you're a married couple with 2 children, you might get up to this much. But the amounts, it's phased out. So for people above at certain income levels, So they couldn't just say, here, just let's make this easy. Let's give everybody $1,200. So your check is gradually reduced to zero if you're single, married, filing a separate tax return, a qualifying widower. Oh my God, just on this point, the complexity already. With an adjusted gross income above $75,000, that's it. So that's where it starts to phase out. It's $75,000. Now, there's a lot of cities where I'll tell you this right now. For myself, for my family, with a really terrible, bronze level health plan in the United States as a self-employed person, that I have to pay close to $28,000 for this really dumb plan. It's awful. So you take that and a mortgage check, next thing you know, above $75,000 in a city, and that's not a lot of money, but that for the government, that's where they start to phase this out. And it drops completely to zero by the time you get to $95,000 or $98,000 as an individual. And it's based on your last year's tax return. So what if you just lost your job right now? Tough. You're out of luck, right? Okay, all right. But maybe what if it's based on my return? It's my 2019 return better. If I haven't filed it, you got a decision to make. So maybe talk to your accountant. That'll only be $300 to talk to them. And you're just, look at all this complexity. It's a super complicated program. Now, what if I had a child, but I haven't filed yet? And on and on. Look at this. Young people living with parents, you got to think about this. Non-resident aliens, will they get a check? Nope, not now. But I hear Nancy Pelosi saying maybe they should too. On and on and on. All right. So that's part one. So part two is, well, when is this thing coming out? Right. Well, check this out. If here's the schedule, if you earn $0 to $10,000, a check is going to be mailed on April 24th. Well, today's the 7th. So it's another 17 days from now. And a week after that, everybody who was earning, if your income was 10 to 20,000, you'd get a check. And what if you're earning 20 to 30,000? You're totally out of work now. You've been out of work for months. Well, May 8th, you might get a check. What if you earn 30 to 40,000? Well, then it's May 15th. Look at this schedule. Look at this. Some people aren't going to be getting any checks. Well, obviously it phases out here, so this doesn't even work. But, let's say if the phase out is 150,000, the people at the end here aren't getting checks till the end of July, right? So that's why I said, when days count, those checks are just months away. This is not sufficient. Like, there's just no way that people who are struggling right now, who are out of work right now, and there's no explanation for why you would phase it out and you would send checks by the week. Why can you only do a batch a week? You know why? Because there's all this complexity built in. That's because we got bad managers, not leaders. A leader would have said, listen, we're going to do speed over this complexity. We're going with simple. Just send everybody a check for $1,200 right now. And we're going to send everybody a check for $1,200 every 2 weeks until this thing is cured and cleared, or whatever you need to do, right? But that would have been giving money to actual people. And by the way, if you are a taxpayer in the United States, which I am, you find out that the more you pay in taxes, the less you qualify for something like this. So it really is sending a message that says, for those of you who pay the most taxes, we're going to specifically exclude you, once again, from receiving any sort of stimulus, which you can make an argument that that's maybe a little bit more fair, but you could make an argument it's less fair. You can make whatever arguments you want, but the truth of the matter is they're dripping this money out at a time when there is a hemorrhage of cash flow to these affected families, millions and millions of them, right? And at any rate, I just find this dumb, really dumb. I call this a self-inflicted wound. All right, remember, we've talked about a gold standard pandemic approach. How do you deal with a pandemic? But already we're starting to ask the questions, how do we get past this, right? So here's some thinking, just some thinking. I don't claim to have all the answers here, but here's some thinking, some logical thinking to say, here's how we might get past this. Okay, the first thing is you got to find the best treatments, pronto, and you got to standardize around those. So there should be, if the CDC is going to do anything useful here, if the WHO was ever going to do anything useful, the doctors and nurses and practitioners in all the hospitals are just busy gathering data, treating as best they can, and it's not up to them to try and form an impromptu network, although I know they are doing that, getting on conference calls and Zoom calls to share this stuff. Somebody ought to be collecting that data. Remember I said that right here? Treat and then collect all the data and share it. That's really important. So we need to do that. If I was in charge, we would have a national program, very dedicated, the sharpest people I could find who would be just sifting through all of the patient data. And so that we could actually come up with a treatment protocol and we could standardize around that, right? It might be fairly complex. I'm not saying this is simple, but it would be standardized because we would know it would work. Right now, what would that be? Probably early on in the cycle, you would always, unless there was contraindications that were really, something that was very powerful against it, you would do hydroxychloroquine, zinc, and azithromycin or Z-Pak. All right. Hey, I presented that heme theory talking about treatment stuff, and then somebody sent me this article, and it's everything I talked about, but much better done. I should have read this first. I didn't find it, but you should read this if you're at all interested in this theory. This person has laid it out in a really clear, really easily understood way. So if you're interested in this theory, check it out. But at any rate, it really supports this. It's an interesting line of thinking, which really supports the idea that this may well be a blood disease, something that's attacking the hemoglobin, and that it's the liberated iron that's really causing a lot of trouble. This spells out the theory much better than I did. So check that out. Liberty Maven stock here. Put it out on April 5th. I should have found it, but I didn't. So try that. All right. So let's say you have these best treatments. It's Zithromax plus hydroxychloroquine and zinc. Then you got to test for the antibodies, but you got to be smart about it, right? And all the recovered people need to go back to work in critical positions immediately. And maybe they don't even go back to their old job. Maybe it's something else that really needs to be done that they would be more suited for. I don't know, working in a grocery store because that's what we need most, or delivering food to the elderly because that's what we need most. But there should be a smart plan for what we need people to get back to work first and send them back there, rather than saying, oh, well, you used to work at a Starbucks. I guess you got to go back to work at Starbucks. That's not what the nation needs right now. I know we'd all like to get our coffee back, but that's not what we need first. All right. So test for the antibodies, because what we want to know is, are we in scenario A or scenario B too? We want to know this. Scenario A means that there's some infected people who we don't know about. We know about the infected people because those are reported on a daily basis, but most of the population is still uninfected individuals. That's a very different outcome to the future than if we're facing scenario B, where there's a lot of people who have been infected. They are unknown, though, either because they were asymptomatic or they were just simply untested, even though they might have been kicking and screaming to be tested because they had all the basic symptomology. They lost their sense of smell, ripping headache, fatigue, the fever, all of that stuff. There are people presenting with all of those, plus having been in contact with a COVID-19 patient and still not getting tested. Maybe they should have tried being a tiger next time. Apparently they can get tested, or a rich person. They get tested pretty quick too, or famous. But what is it? Scenario A, scenario B. So we need to know. Antibody testing will begin to solve that riddle for us, because the antibody test will detect these people here, and all the blue dots here. That's what I'm highlighting here. And the PCR test for the RNA, well, that detects all your red dots. So we need to know, obviously, who's infective with the red dots, but we also need to know who's been infected and who is now clear of the disease. So how are we doing on that? Well, let me talk about that antibody test in just a second. First, I'm a little worried maybe we're more of a scenario A than a scenario B. Now, this is a study, and it's a modeled study, so this isn't like we went out and tested data and got data back, and that's what we're discussing here. This comes again through the Imperial College of London, which includes Neil Ferguson, who we've featured here a number of times. And so this study came out March 30th, and I finally made it all the way through it. It's kind of long. Estimating the number of infections and the impact of non-pharmaceutical interventions on COVID-19 in 11 European countries. So a couple big things jumped out of this. First, I just want to point this out. They said here, averaged across all countries, we estimate initial R0 or reproduction numbers of around 3.87. So that was the mean of a variety of estimates and sampled estimates they came up with. The range of the R0 from 3.01 to 4.66. So yeah, remember when we were talking about this stuff back in the day and saying, numbers like this really got ridiculed for that? But I think it's pretty clear. How could it not be clear? This thing spreads super easily. That means it has a very high R naught. Now, what's interesting is the R naught is not a intrinsic number that you just have to live with. When they say initial reproduction number, that is the reproduction number of this virus without any NPIs, without any social distancing, without everybody wearing a face mask, without any of that stuff happening. Once you start doing that, plus the lockdowns, this and that, you impact the reproduction number, and it goes away from the initial R naught and becomes a different reproduction number. This is the model they used. I'm going to show you this real quick just because it helps to inform what's coming next. And so there are all these things that all the countries could do. These are effects shared for all countries. So all the countries they studied, they banned public events. They had social distancing was encouraged. They closed schools or universities. They had case-based isolation. They went into lockdown, onset of first intervention. So all of that stuff, they had the country-specific interventions. They fed it into the model. You have your basic reproduction number, which is the one you start with. These things impinge on that, and then you have what's called a time-varying reproduction number. So R naught might go from 3.87 to 2.5 to 1.5 to 0.87. So it varies depending on time and what you're doing here. And so then this led to them modeling the number of infections, all right? And this led to modeled deaths. But then they said, well, how did that do compared to observed deaths? And the reason this is all interesting is because they were able to show that by focusing on deaths, they could get a very good handle on this part right here, population averaged infection fatality ratio in infection to symptoms distribution. So this part right here allows them to estimate through the model based on how many deaths were observed and how close their model deaths came to that until they tweaked the model, got it right, to give us this, which is what percent of the population was infected as of 28th of March of 2020. That is, are we in scenario A with most people uninfected, or scenario B, more hopefully with most people infected? The answer is scenario A. So as of March 28th, their model spit out the results that said Austria had about 1.1% of its total population infected. Okay, Belgium at 3.7%, so that's a lot higher. Denmark at just 1.1%, France at 3%, Germany only at 0.72%, which is kind of interesting given all the testing and everything like that. But here we go. Check this out. Italy at 9.8%. Now we're getting somewhere. That's starting to, you have a serious number of people that you could find with antibody testing and get them back to work. Spain clocking in at 15%. So when you're wondering why Italy and Spain had the most deaths, when we're looking at these charts right here, despite having a fraction of the population of the United States, Spain and Italy have these huge death counts here, right? 13,000, 16,000. And at least part of the explanation for that would be found in this model where we're seeing that a very large proportion of their population, nearly 10%, 15%, has already been infected. But on average, though, you look across all this stuff and what we're not seeing, this is a little bit more scenario A than scenario B. So this impacts very strongly what we can do, because how do we get past this? Some people are just saying, well, it must have been in the country a lot earlier than we thought. Maybe almost everybody's already had it. And therefore we're past the peak and then we're done with it. This data says, nah, that's not true. And this data says there's going to be a second wave in the fall if this thing does go away in the summer. This says that we're a long way. As far along as Spain is, it's nowhere near the 80% of its population that would need to be infected and cured and cleared in order for it to have herd immunity at that point in time. So we're still at a big gap between the number of people who currently have been infected or are infected and the herd immunity we need and the arrival eventually of a vaccine at some point in the future. We've got to manage the next year, it looks like. So how do we do that? Well, if we could test for these antibodies, that would be great, because then we would know, right, who's been infected. And if you know that, well, then you can send all those recovered people back to work and put them in critical positions. Do that immediately. That's how we start getting back to work. Had a bummer of a setback here. This just got announced today. New test hopes dashed as UK finds antibody kits don't deliver. That's a kind headline, by the way. The UK became the latest country to stock up on faulty COVID-19 tests after Oxford University researchers found that many of the kits can't accurately show whether someone was exposed to the new coronavirus. That's as good as saying they don't work. Multiple tests provided for evaluation have not performed well. That's British understatement. They stank. They were really bad. They just didn't work. And home testing kits are designed to look in people's blood for antibodies produced by the immune system to fight virus. Many countries are hoping these kinds of tests can help grasp the true scope of the pandemic and reveal who has built up immunity to COVID-19 and can return to a more normal life. But they have to be accurate, of course. Germany estimates such tools may be 3 months away. That's really frustrating. Antibody tests should be some of the simpler things that we can do because we have lots of antibody tests out there that home pregnancy tests and home all sorts of tests. Many of them rely on antibodies. All right. Get wonky here for just a second. The reason that these test kits failed is they either weren't sensitive enough or they weren't specific enough. So they failed in sensitivity or specificity. In medical diagnosis, test sensitivity is the ability of a test to correctly identify those with the disease. That's a true positive rate. So if your test is sensitive, it's going to be finding these people. It's going to be sending you true positives, okay? Whereas test specificity is the ability of the test to correctly identify those without the disease. So it's giving you a true negative. And of course, you can have a false negative here. So you have people with the disease condition. In this case, it's patients with cancer, they're saying, but let's imagine it reads patients with COVID or patients that had COVID. A false negative right here would mean that your sensitivity wasn't that good. It gave you a bad reading. And a false positive over here said the specificity wasn't that good because it was supposed to tell you that the person was negative, but it said the person was positive. So you can have false negatives, false positives, and those are the two measures: sensitivity versus specificity. Because I'm going through this wonky stuff because you're gonna read if you're at all curious and you read the articles about this, they're gonna tell you that the tests weren't specific enough or sensitive enough, right? So there it is. There's the data. All right, and then 3, what do? Well, you isolate all at-risk people. Everybody goes back to work with new instructions on how to distance and use personal protection equipment, right? So let's take all the people with comorbidities, with autoimmune diseases, with compromised immune systems, whatever we know those risk factors to be. You get a big national commission together. They figure this stuff out. We identify people, bust the HIPAA laws if you have to, call them up and say, hey, you're at risk. We're gonna insist that you isolate. Everybody else who's in a very low risk category, of course, anybody who's already tested positive and has gotten past it, go back to work. But everybody else, you go back to work, but now with new instructions on how to distance yourself and how to use PPE properly. And of course, everybody's wearing a mask. Even the people, everybody, I think you just have a law. Everybody wears a mask, even if they are known to be cleared of the COVID. Because you know what? We're seeing cases where people are coming back with it again, or maybe they could be carriers. We don't know. And plus, you don't want to have to guess. And then some people think, well, I don't like wearing the mask. I'll just pretend. I see other people not wearing them. Other people might think that I don't have the disease too, even though I haven't been cleared of it. So it's just simpler. Everybody wears a mask. That's what you do for a while. That's the story. But otherwise, a mask is just part of the story. Obviously, you have to undertake all appropriate social distancing measures, and you got to do that immediately. And you've got to avoid all gatherings, large and small. You just got to avoid them. Once everyone's wearing a mask, we can relax this a little bit, but not all that much, not entirely. Everyone in public has to wear a mask at all times. No exceptions. Just for the logic I just put up. That's it. But especially sick people. If you're sick, you got to wear a mask. No more. This is going to be a great change that comes from this. We're not going to get on a plane and you're going to have that person 3 rows back on, right? It's just disgusting. And maybe we can now be done with that. That'd be fantastic. That person, people who are coughing and sneezing, I don't care if it's hay fever, you're wearing a mask. All right. Decontaminate all surfaces. You got to get used to that, and got to get used to anything you touch out there in the world is contaminated. You want to bring that back into your green zone at home, particularly if you're sharing a home with somebody who is one of the people who needs to remain isolated. Wash your hands, all of that. Okay, even if we do all of that, based on the economic damage I see coming, I'm going to ask you to plant a garden. We have this linked right here, peakprosperity.com/DIY garden. Help you get started on that if you want to. All right, conclusions. Hey, cats can catch COVID-19, and using the precautionary principle, we got to assume the cats can spread it to humans as well. We have to assume that until it's proven otherwise. That's what we got wrong at the beginning of this, was not using the precautionary principle. Listen, if cats can catch it, maybe they can spread it. We're going to hold that as true until it's proven otherwise, based on the precautionary principle. Botched stimulus efforts. They're going to ensure a really painful economic future. There's just a million stories of businesses that have gone out and cash flows that got ruined and business supply chains that got wrecked, and nobody knows how to put Humpty Dumpty back together again. And $1,200 coming in a couple months ain't going to cut it. All right. There is a way to get back to work, but we've got to be a lot smarter about it than we have been about all the other matters to date. So we can be hopeful, but unless a new all-star team comes in and really starts to take over and can be logical about this, I don't have a lot of hope for this yet. But I'll put this out there in case somehow this can influence the conversation. Listen, everybody has a role in this. We're all just in this together, and this is really a time to pull together. And I'm so proud of the small company Sway So Shop that put the masks together, the way they went about it, the way that they went about it, which was smart, and thoughtful, and logical, and all of that. And they just totally outclassed the Surgeon General by 1,000 yards. That was the JV team took out an NFL team in football, and they did it by 30 points. It was that embarrassing for the for the NFL team in that particular story. So maybe better luck next time, huh, Surgeon General? All right, with that, I'm all done for today. Thank you very much for listening. We'll be back soon.
Hi folks, Adam Taggart here. Chris Martinson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.